we're concerned that that doctor may not have enough experience to be able to know how to monitor and make decisions about what the treatment is. So I'd say the first thing is, well, actually the first thing is to know whether you're infected or not. About a year ago now, the Centers for Disease Control recommended that everyone aged 13 to 64, and I think that probably includes all of us, including the women, I hope.
Thank you, but you're about 10 years off of
everyone aged 13 to 64
That's a compliment.
Yes, it is.
should be tested for HIV at least once. And if people are continuing to have risk behavior, they should get tested again and again, depending upon how much risk they're engaging in. So the first thing is people need to know whether they're infected or not. They need to know their status. And then if they know they're infected, they need to get into care. And we have a program in King County called One-on-One, which sees people who are newly diagnosed with HIV infection. And we try to help people figure out where there are good places to get care. Madison Clinic is one such place. A lot of patients taken care of there, probably 2,000 I think in that clinic now. But there are also a lot of docs scattered around the county that are experienced in taking care of people with HIV AIDS. And then once you're into care, then you need to have your T cells monitored every 3 or 4 months, and you need to have your viral load monitored and see when it's appropriate to start treatment, because we don't treat everybody with HIV infection. Treatment's a little toxic, it's very costly, and we typically wait until people's T cell counts are down around 350 before we begin to recommend treatment. But ultimately it's the patient's decision, and it's a decision I know that case managers get involved in and pharmacists sometimes get involved in to make sure that the patient is ready to enter onto a treatment regimen that is going to be the rest of that person's life, essentially. And then they need to continue to have their T cells and their viral load monitored. And if the viral load begins to go up or the T cells begin to go down, maybe they need to change the regimen of medicines that they're on. But basically, getting into care, knowing your status, those are the, from a public health standpoint, those are the most important steps for people to take.
Now, with conventional medicine, I can totally see it, but what about patients who choose to go with a, I would guess I would say more of a charismatic approach to their health care, with maybe medical cannabis, for an example, or anything maybe in that neck of the woods that helps people. Dennis, for an example, he is a medical cannabis patient and advocate. And you know, we have learned his status even through his mom, bless her heart. But Dennis, how would you identify with what the doctor is saying?
Oh, I agree with everything Dr. Wood just said. I chose the route of trying to feed my immune system and give my body what it needed in order to give it every chance to fight on its own as long as possible, to delay the time that I would need to start on the meds, because in many people's case, the meds eventually will fail or they become less effective over time, and so you only have a certain number of classes of meds that are available, and so I wanted to stretch that time out as far as I could before I got on them, and it was 18.5 years after I was infected before I started on the meds. But having said that, in the meantime, the year before that, I did come down with non-Hodgkin's lymphoma, so I might have waited a year or so too long. But things have worked out for me, and by taking the approach I have taken, I believe that's been part of the success that I've experienced. In my case, as in many of the very long-term survivors' cases, I'm the only person that I know from my old life that has survived. And so many of the others took the meds right away, and they ended up building up toxicity and not being able to tolerate the meds early on, so that they failed. So in my case, I try to feed my immune system as much as I can through...
What do you mean by that, Dennis?
What?
in feeding your immune system.
He eats a very healthy lifestyle. When Dennis was first diagnosed with HIV, the only thing they gave anybody was AZT, and that killed you. So I just became very upset about it, so I read everything I could find on herbal medicine and just herbs and good eating. And Dennis was always been a health food nut anyway. But I got into growing medicinal herbs because of his illness. And it made me have a healthier lifestyle. And I really, really think that his healthy eating habits had a lot to do with it, which is what he's saying, feeding his immune system.
Well, Doctor, how do you feel even about patients who want to take this approach versus only depending on what comes out of a pharmacy?
Well, I think you need multiple approaches. First, I want to say that AZT is certainly touted to be a toxic drug, but I was on it for a while myself, and it actually helped to keep me alive.
Oh, really?
And a lot of people are taking AZT, so I don't want the viewers to think if they're on AZT that it's going to kill them, because it is one of the drugs that we use in the cocktails that we treat people with who have HIV and AIDS at this point. And it's actually one of the best drugs to use if there's a disease of the central nervous system, because it can cross the blood-brain barrier and apparently defeat the HIV virus inside the brain compartment. So it can be a very useful drug. Actually, I was on AZT as a single agent drug back in 1986-87. I got tested in 85 and discovered I had HIV in 85, and I probably got infected in 83. So I'm going on 31 years, I think now, with HIV infection. 34 years, whatever that subtraction is. We counted a little while ago, but I'm not sure I could calculate it in this bright light. But AZT can be a very useful drug in some people for sure, and it's part of the regimen that people are given. But the other point that I wanted to make is that cannabis may be very useful in people with HIV and AIDS. I'm not sure what it does to the immune system. There are some studies that suggest it's not good for the immune system, but it certainly picks up people's appetite, takes away nausea, and can be useful in people not just with HIV and AIDS, but a lot of other chronic diseases. But it's not an agent that will suppress HIV. No. So, you know, if people want to take cannabis for good reasons, glaucoma or loss of appetite or nausea, then you can, in this state, fortunately, you can get a recommendation from a doc. You still have to figure out where to get it and how to avoid the police. But cannabis is not going to do much in terms of strengthening the immune system, at least from any of the studies that we've seen published so far.
Well, let's talk a little bit about, I mean, we could, of course, go back to back on the medical aspect, but it's very powerful to look at it from both standpoints. But for the sake of good measure, let's get into second gear here a little bit and talk about why that it is important for folks to have a good network of people, friends and family, those that are around them, social gatherings such as with the Dungy House in Seattle. From your experience with being there, I'm not sure how long that you've been there, but what is your primary objective with the people that you see? I mean, they may be mad at their doctor. they may decide to take the same approach to their health care as Dennis has, or even our director. But how does SASG fit into it?
Well, above all, we try to provide a safe space for people to come and anonymously, if they choose, and to just share their troubles with other people who are experiencing the same things. And that's what we've done historically for coming close to 25 years now. As far as having a particular agenda or goals, you know,